colonoscopy can be a dreaded procedure. Having someone look where the sun doesn't shine can be somewhat embarrassing. Would you do it if it could potentially save your life? A colonoscopy is a simple procedure that can diagnose many diseases of the colon, and it could potentially save your life. It's important for all age groups to know their risk factor for colorectal malignancy and to know the importance of having a colonoscopy. I've worked in the healthcare field for more than a decade. I've seen the effects of colon cancer. I currently work in an office where we do colonoscopies nearly every day. I've done further research and I've learned so much more about colonoscopies. Let's expand our knowledge of the colonoscopy. There are many reasons why your doctor may recommend a colonoscopy. According to Ronnie, Karen, Robin, a couple warning signs that you may need a colonoscopy are a change in bowel habits, like constipation, diarrhea, or black or bloody stools. In fact, Silen states that a change in bowel habits, such as constipation or diarrhea, that lasts more than a few days are red flags. Abdominal pain, distension, fatigue, and weight loss are also warning signs that may warrant a colonoscopy. Silen advises any abdominal pain, distension, and cramping that is persistent should not be disregarded. Raven states that unexpected weight loss and fatigue can also be symptoms that should be looked into. Screening is another reason for a colonoscopy. According to the American Academy of Family Physicians, the early stages of colon cancer have no symptoms. That is why screening is so important. The same source confirms that most people should start screening at the age of 50. Rabin further explains that if you have a first-degree relative with colon cancer that was diagnosed with colon cancer, you should start screening at 10 years before the age that they were diagnosed, or at the age of 40. Did you know that colorectal malignancy is the third most common cause of cancer and the fifth most common cause of cancer death, according to Eli Levy, Daly, and Tu, published in the Journal of Colon Cancer Education? According to Eli, Daly, Levy, and Chu, many of these deaths may have been prevented with screening. The next thing that you need to do is discuss the procedure with your doctor. According to the Crane's Patient Education, it describes a colonoscopy, also known as a lower GI endoscopy, as a procedure that allows your doctor to view your lower gastrointestinal tract. According to Crane's, the patient must prepare for a colonoscopy. A few days before the colonoscopy, they should eat a low-fiber diet. The day before a colonoscopy, they should follow a clear liquid diet. The most important thing is to follow the bowel preparation that their doctor gives them. Make sure you follow your doctor's orders, because if your colon is not clean from the bowel preparation, then the doctor may not see all of the colon that he needs to. Per Crane's, during the procedure, you may be given a medication to help relax yourself and take a nap. Then, an endoscope is then inserted into the rectum. This sends live video feed into a monitor. According to the American Academy of Family Physicians, the doctor will remove any polyps while he's in there. After the colonoscopy, in the recovery room, you will rest. Cranes explains that any polyps that are removed, they will be sent for further evaluation. It may take up to a week to get the results of the biopsies. Once the procedure is over, the next stage is treatment. Treatment is determined by what the doctor sees during the colonoscopy and what the biopsies show. If you had a normal routine colonoscopy, follow-up may be suggested. According to the American Academy of Family Physicians, you get a 10-year pass till your next colonoscopy. If you have benign polyps, nothing wrong there, you get another 10-year pass. According to the American Academy of Family Physicians, precancerous polyps will warrant a sooner colonoscopy than 10 years, because this shows that you may have an increased risk of developing colon cancer. If you're diagnosed with colon cancer, your surgeon may need to remove any remaining portion of the cancer, and they may need to refer you to a specialist. You will need a repeat colonoscopy in less than a year or before. If you're diagnosed with colitis or any other inflammatory bowel disease, your doctor will treat you appropriately. Having a colonoscopy is a simple procedure, and it takes bravery. We've went through all of the reasons why you need to have a colonoscopy. The preparation and the procedure can be scary, but not as scary as what could happen if you don't have the colonoscopy. Following through with treatment is just as important as having the colonoscopy. Like I said, a colonoscopy is a simple outpatient procedure that could save your life. I hope I've given you the knowledge that you need to understand the importance of a colonoscopy. Thank you.